heart failure and pulmonary hypertension. My name is Rita Sochi Estrada.
I'm Juan Alvarez.
And I'm Alicia Nguyen.
Okay, we're going to start with heart failure. So the description of the disease. There are two types of heart failure. There's left-sided and right-sided. And dysfunction of the left ventricle are responsible for most heart failure. Risk factors and occurrence rates. So the two most significant risk factors are heart disease and hypertension, followed by age, obesity, diabetes, renal failure, and other things. It affects nearly 10% of adults 65 years and older, and about 6.2 million adults in the US have heart failure, about 1.8% of the population. And it increases with age, 4.3% of adults 65 to 70 years old. Now, the pathological mechanisms for the left heart failure is categorized as systolic or diastolic. Systolic heart failure is defined as an ejection fraction less than 40%. And this leads to increased preload and decreased contractility, increased diastolic pressure, and various other things like pulmonary edema. For diastolic heart failure, it's defined as pulmonary congestion despite a normal stroke volume and cardiac output. And it's the cause of nearly 50% of heart failure. It results from decreased compliance of the left ventricle and abnormal diastolic relaxation. Now, these changes result from ventricle remodeling with alterations in the extracellular matrix and myocytoskeletal changes. For right heart failure, it's defined as the inability of the right ventricle to provide adequate blood flow into the pulmonary circulation at a normal central venous pressure. And as you can see from the side, you have an increased pulmonary vascular resistance, an increased force of RV contraction, an increased RV oxygen demand, and all of this will lead to peripheral edema. Signs and symptoms. For systolic heart failure, it's hypotension or hypertension, dyspnea, cough of frothy sputum, fatigue, decreased urine output, and of course, pulmonary edema. For diastolic heart failure, the symptoms and signs are dyspnea on exertion and fatigue. And for right heart failure, it's going to be almost identical to systolic heart failure.
Okay, so physical assessment. If you're showing those signs and symptoms, you're going to go get checked out by a doctor, and it's pretty similar to what we're practicing in lab at the moment. We're going to inquire about your medical history and your symptoms, time to do old cart, how long they've been going on, what makes them worse. Weight is taken. You're checking for edema, most likely seeing if there's any type of fluid buildup that's making the patient gain weight. Blood pressure and pulse rate, those are the biggest ones affected. And then listening to the heart and lung sounds is pretty critical because that's what is the main indication that the heart is failing. And then when you're checking for edema in the body, you're really looking at the abdomen, the legs, and the ankles. Those are the number one areas where the swelling would occur. And then you also want to take a check at the veins in the neck for the carotid artery. Other things to keep in mind, this is what for the first exam, it's a little difficult, so it'll be a series of examinations, but you want to bring all your medications just to see if that's what's making the heart effective or kind of contributing to the failure. And then you want to be honest with your provider regarding your diet, your smoking habits, drinking, exercise, lifestyle habits, including drug use, and stress. And then blood tests and other tests can be ordered. Next. So some diagnostic tests. Really, we just want to take a look at the heart and get a clear picture as to what aspect of it that is failing. So that can be seen with a chest x-ray, an ECG or an EKG, same thing. It's checking the rhythm and electrical activity. You can also do a stress test, checking the heart when it's in motion of exercise. Doing a CT scan with or without contrast, an MRI, a coronary angiogram, which is when they put a thin flexible catheter from the groin arteries into the heart, and they put a dye so it can show on the x-ray a better picture. And then a ventriculogram, which is showing the ventricles of the heart to see how well they're pumping. And then other tests, with your blood tests, you're checking the sodium, potassium, albumin, creatine, BUN, CBC, and certain biomarkers, really checking that kidney function as well, seeing if that's affecting the blood volume. You could do a biopsy for very serious cases. And then you're really also looking at the ejection fraction rate, which is the fraction rate to see how much blood is being pumped out of the ventricle. For a normal healthy human being, it's between 50 to 75%. So anything less than that indicates heart failure.
All right, so the treatment plan for heart failure. So it's very medically managed. So usually patients are prescribed a combination of medications, and those include ACE inhibitors. These work by relaxing the blood vessels in order to lower blood pressure and increase blood flow. Angiotensin II blockers, and these work by relaxing veins and arteries in order to decrease blood pressure and to help the heart pump blood. Also beta blockers, and these work by lowering blood pressure by causing the heart to beat more slowly and with less force. Cardiac glycosides, these work by increasing the strength of heart muscle contractions. Diuretics, so these are also known as water pills, and these work by causing the patient to experience more frequent urination in order to get rid of excess fluid in the body. An important thing to know with diuretics is that they may lead to low potassium levels, so sometimes potassium supplementation is important. So more on treatment plans. So there's also surgery. So if a patient's heart failure is being caused by coronary valve issues, a coronary bypass surgery might be indicated. ICD, which stands for implantable cardioverter defibrillator. So these are implanted into patients, and these monitor the heart for abnormal rhythms. If the heart does start to beat abnormally, the defibrillator will work by getting the heart getting the heart back into rhythm. In more severe cases, a heart transplant might be indicated. If medications and the medical treatment is not working, sometimes patients do have to be referred for palliative or hospice care. So patient education, so it pretty much revolves around medication adherence. So we have to teach our patients to make sure they follow the medications that they're being prescribed, and they're taking them based on the prescriber's instructions. Low sodium diet is very important. This is to control blood pressure and also to prevent excessive fluid retention. Exercise is going to be vital also. And then we have to educate our patients on the symptoms of heart failure exacerbation. And this is important because it helps the patient know when it's time to seek emergency medical care. Also teaching them about daily weight to assess their volume status. So here we have an example of a patient education handout that was developed by the Cleveland Clinic. And pretty much it just gives the patient tips on what to do on a daily basis, such as weighing themselves, taking their medications, checking themselves for any swollen feet. And then depending on their symptoms, it'll put them in a zone, and ideally they should be in the green zone. If they end up in the red zone, that's when they should call 911 or go to the ER. For prevention and health promotion, so heart failure is caused by a variety of heart-related conditions. So if a patient is diagnosed with things such as high blood pressure, high cholesterol, the patient should make a big effort to control those. Also, heart-healthy diets that are low in sodium, low in saturated fats, and simple carbs might help with preventing heart failure. Maintaining a healthy weight and being physically active are also very important. Community resource. So this was by Project Angel Food in LA County. So they did a pilot program for 3 years. We're still waiting on the results, but it was pretty much this organization providing meals that were tailored for these for CHF. And the goal was to prevent hospitalization and to improve health outcomes. And now we are going into pulmonary hypertension.
Now, the description of the disease is high blood pressure in your pulmonary arteries caused by increased pulmonary venous flow due to heart disease, increased pulmonary venous pressure increased pulmonary vascular resistance. Now, in vascular resistance, it's caused by destruction of the pulmonary vascular bed and or pathogenic or pathologic vasoconstriction, endothelia, and smooth muscle proliferation, which leads to hypertrophy and chronic inflammation, resulting in vascular wall remodeling. Now, for venous pressure, is most commonly caused by left heart failure, resulting in elevated pulmonary venous pressure, damaging the alveolar capillary wall, causing pulmonary edema. For venous flow, it's caused by heart disease and may lead to pulmonary vascular lesions. Risk factors: family history of the condition, being overweight, blood clotting disorders, or family history of blood clots in the lungs, and exposure to asbestos, to name a few. 27% reported fatigue of patients that had it. 15% reported fainting or lightheadedness. 22% reported chest pain. 21% reported edema swelling. 13% reported palpitations, and 86% reported shortness of breath. Now, pulmonary hypertension is actually pretty rare, and so there isn't very much data in the US. However, some commonalities occurs in all ages, but there is a higher risk in persons that are 75 years or older, in women, and non-Hispanic Blacks. Heart failure is common in pulmonary hypertension. The signs and symptoms: cyanosis, chest pressure, pain, dizziness or fainting spells, palpitations, fatigue, dyspnea, and edema.
Okay, so physical assessment, it's very similar to heart failure, but keep in mind, pulmonary hypertension is difficult to diagnose on routine physical exam. Generally, an ECG is the first test done that will indicate possible pulmonary hypertension. So physical assessment is very similar. It inquires about your medical history, but it's also going to take a look at not only the heart, but the lungs as well. So you're looking at blood pressure, pulse rate, definitely doing the pulse oximeter, the heart and lung sounds, checking the veins around the neck, and still checking for any type of fluid buildup, edema, ascites, same given areas. Other things that might be implemented to check the oxygen levels is a 6-minute walking test. That's when you have the pulse ox and a heart monitor on you, and you walk for about 30 meters just to see if there's a change in any of the two readings. And then there's some more tests that can be done. So very similar is you're doing the chest x-ray, getting that overall picture, heart and lungs, which one's being affected, the ECG, the echocardiogram. This one is also a right heart catheterization. Keep in mind the right side of the heart is what pumps deoxygenated blood to the lungs to get oxygen. So you really want to take a look at what's going on in that given area. CT, MRI, also a lung pulmonary function test, a sleep study, because pulmonary hypertension might be underlined by sleep apnea. So I just want to take a test on that one as well. And then the ventilation perfusion BQ scan, which is another test that uses nuclear medication to take a look at the respirations. And then other labs, you're still looking at the same blood tests, but you're also still looking at the kidney function to see if anything is being related due to that. And also for extreme cases, an open lung biopsy.
All right, so the treatment plan for pulmonary hypertension, so it also involves medications, and these are used to treat symptoms and also to slow the progression of the disease. So they include vasodilators. So the way these work is by improving blood flow by relaxing and opening narrow blood vessels. Guanylate cyclase stimulators. These work by relaxing the pulmonary arteries and lowering pressure in the lungs. Calcium channel blockers are medications that help relax blood vessel wall muscles. Blood thinners are used to prevent blood clots, especially pulmonary embolisms. Diuretics are used to prevent fluid retention. And with pulmonary hypertension, oxygen therapy is going to be very important. And this is just to ensure that the patient is receiving adequate oxygen. With more severe cases, a lung or a heart-lung transplant might be indicated. Patient education for pulmonary hypertension revolves around the importance of medication adherence in order to treat the symptoms, and also a low sodium diet to prevent excessive fluid gains. How to prevent pulmonary hypertension. So it's going to be very important to manage any conditions that may lead to this condition, and that includes managing heart disease, liver disease, lung disease, and also avoiding smoking or chewing tobacco. And here we have a comparison between both conditions, heart failure and pulmonary hypertension. So there's a few commonalities and differences. Incidence is a big difference. So heart failure affects 6.2 million adults. Pulmonary hypertension is a bit more rare. There's only 500 to 1,000 new diagnoses annually in the United States. Symptoms, so there are some similar symptoms such as fatigue and dyspnea. However, with heart failure, there's also the decreased urine output. There's a coughing and frothy sputum. There's pulmonary edema, and there's also hypotension and hypertension. While with pulmonary hypertension, some other common symptoms are cyanosis, heart palpitations, and also dizziness or fainting spells or syncope. Treatment, so both conditions are very heavily treated with medications. There are some similar ones, but with heart failure, ACE inhibitors are the most common ones, beta blockers and diuretics. While with pulmonary hypertension, vasodilators and oxygen therapy are going to be very important. Diagnostic tools, so both do require chest x-rays, electrocardiograms. However, with heart failure, and stress tests may be indicated. Also, a cardiac computerized CT scan. While with pulmonary hypertension, the patient might require a sleep study. Pulmonary function test is to specifically test the lungs function, and also a right heart catheterization might be necessary. And this concludes our presentation. These are our references.